Who is the ideal candidate for the corset contour? The ideal candidate for this procedure is someone who's going to be thinner. You know, in general terms, I'm looking for someone who has a BMI less than 30. And it's not a hard number because there's women who've had procedure with liposuction already, and their soft tissue of their back is not going to be quite as thick, and so it might be doable. But I think one of the hard indications for me of who's a good candidate is how much intra-abdominal fat that they have. It's very, very, very important. And let me tell you why. So when you have, you have organs in your abdomen, you have the fat floating around there, and it's helped to protect your organs and keep everything soft in a nice, soft, comfortable environment. And if you have more intra-abdominal fat, okay, and if you have more intra-abdominal fat, and I infracture your lower ribs, you're squeezing basically a balloon. And if there's still too much in there, it pushes out the front, okay? So if you have a lot of intra-abdominal fat and I squeeze your ribs, I can just show you physically, like when we squeeze your ribs, it comes out the front. And so aesthetically, it doesn't make sense. It just doesn't make sense. And so I need women who have lower intra-abdominal fat content. So the clinical sign for me, the test that I would do, is just have you take a deep breath in and try to pull your abdomen up into your chest. We call it the vacuum in bodybuilding. Try to pull your abdomen. If you can get your abdomen all the way sucked in to your rib cage, then you're going to be a great candidate because you don't have a lot of intra-abdominal fat. And so when I, do the infracture and I squeeze you down, you won't have anything really to squeeze because you have a lot less intra-abdominal fat. And those are the best candidates. So those are patients who are a little bit leaner, don't really gain weight, easily do like a BBL. They're going to be my athletes, they're going to be my fitness models, women who are just built straight. So they have a very straight contour, and so they want that smaller waistline. And so this procedure is going to be a game changer for them because I'm going to give them a much, much smaller waistline permanently. So great question. Don't forget, like and subscribe. Stay tuned for more and learn more about the corset contour. Thanks for following.